tonight. Welcome, welcome, welcome. Thank you for joining us. Anywhere that you've joined us, put in the chat where you have joined us from today, where you're watching from. If you're watching live, please like, subscribe, and share this conversation because someone might just
Mm.
need this information and education that we're having
Mm.
today.
Yeah.
You know? And tonight we're tackling one of the biggest questions women ask: Are fibroids inherited? Is this hereditary? Can women, pass it on, mothers to children, grandmother, down the line, you know?
Yeah. Yeah.
My,
Do you want me to answer, or you want to just, what do you want?
my mom had fibroids. Can I have
Yeah.
the,
Yeah.
also, we're
Yeah.
gonna,
Definitely the fibroid is hereditary.
yeah.
And if first degree relative like a mother and sister have fibroid, there's a possibility of 3 times
Mhm.
the others they will have a fibroid, 3 times than general population. So it is hereditary because it is related to gene. Part of the development of the fibroid is genetic.
Okay, before we join into the juicy bit, Dr. Omar,
Mm.
I'm just gonna introduce everyone first, and then
Mhm. Mm.
Coach hasn't joined us yet, but just gonna introduce everyone. Thank you for joining me tonight. I have with me consultant gynecologist and obstetrician for many years, looking after women with fibroids. She looked after me. I can tell you that. Thank you for joining us, Dr. Omar.
Thank you.
Thank you for this evening. Thank you for coming to this conversation. I've also got with me, whilst we wait for Kosha, I've got with me Mavi. Welcome, Mavi. Mavi is um inspirational, motivational speaker, and she's also lived experience of fibroids. So welcome, welcome. But before I jump into all of it, one thing I usually like to share, something I've been thinking about and pondering. And one scripture I was thinking about today was, and I can do all things through Christ who strengthens me. And that scripture is Philippians 4:13. So anyone out there, if you're feeling tired, if you're feeling overwhelmed, hang in there, keep going, because you can do this. You can do this. Yeah. So this is something that I wanted to share. But yes, um, Dr. Omar, tonight as we talk about fibroids, if they're inherited or not, what options are available now. We're in 2026, yes. Well, please introduce yourself first, whilst I'll then have Mavi go. Coach can join us. Tell us
Okay.
what you do,
I
and
am a consultant gynecologist. I was also consultant gynecologist and obstetrician. I have my training in all aspect of the gynecology, almost all. And I am very much specialized in a complex gynecology, mostly fibroid and difficult fibroid also, and endometriosis, PMO, polycystic, polymetabolic endocrine syndrome, and other gynecological problem, and including menopause and adolescent also problem, uh, with the adolescent with gynecological problem. I
okay,
work in a few private hospital. One of them is a Circle, and the other one is Nuffield. Um, I retired from the NHS in 2023,
so Dr.
unfortunately,
Honest,
but I am keep going.
we have audience from everywhere, so they know where you work and practice.
Mhm. Mhm. I work in Circle in Chelsea Park in Sloan Hospital. Chelsea Park is in Chelsfield, and Sloan Hospital in Beckenham and Blackheath also. They are all Kent side. And also I work in Essex in Nuffield Health Brentwood. So these are 4 base hospital which I am working in.
Okay, in the United Kingdom. Awesome.
Yes.
Amazing, amazing, amazing. Thank you for joining us tonight. Thank you. Oh, I've got Kosha with us as well. Mavi, do you want to introduce yourself, and then I'll let Kosha do after you so she can get
Mhm.
settled. Hello, thank you for joining us, Kosha. Welcome.
Hello, thank you so much, ma'am, for giving me the privilege to be on this very inspirational program that you have for women. And I'm super, super thankful that this platform has been consistently on since 2021. To God be the glory. Okay, so my name is Mavi. I run Butt of Olives and Girl on Fire Mentoring Academy. I work with young women and teenagers, and I largely help to disciple and mentor the next generation. That's apart from what I do as my day job. I also help people who want to step into the space, into the social enterprise space, to set up and run their social enterprise. I'm also a fibroid survivor. I had fibroid when I was 20, and it followed me until quite for a while. I battled fibroid for a while, and I'm happy to share my experience and how
Story with us tonight.
I'm.
Yes,
Yeah.
so it'll be good to hear your story. Yes, thank you for joining us. So I'm going to go to my other amazing guests. Kosha, thank you for coming. Thank you for joining us tonight. Please
Thank you for having me.
introduce yourself. Kosha is also an educator and
I
a
am an educator.
Tell us a bit about what.
Sorry, I just lost you there for a moment. Hi, everyone. My name's Kashia, and as Sis just said, I am an educator. I've been in education for over 12 years now and working with young people and in the teenagers mostly. I'm also a female advocate where I work with young women to achieve their goals and aspirations.
Amazing. Thank you. Thank you, ladies, for joining me tonight. Thank you, Dr. Omar. For ground rules, I would like to let everyone know tonight, I would like it to be a bit conversational. So please, there are no silly questions. If there's anything you would like to know, you like to ask, please put in the chat box. But remember, tonight is just advisory conversation. Whatever we say is for advice purposes only. Tonight is just general information, and individual medical decisions should be made with your own professional health care provider. Okay, so yes. And if you know anyone who's got fibroids, invite them, ping them, send this link to them. But let's get started. I'd like to go with the doctor first. Dr. Omar, you tell us a bit about fibroids. By the way, it's Fibroids Awareness Month, and I wouldn't want month of July to finish without this conversation. So let's get started with the basics, Dr. Omar. Tell us exactly, what are fibroids?
Thank you. Thank you for that. Fibroid is a proliferation of the smooth muscle cell. The wall of the womb is form of smooth muscle. Smooth muscle, the muscle in the body, each one has different type. Like, for example, the muscle of the foot, hand, legs, and other part of the body is different from this muscle which is in the gut, and also it's different from the muscles which is in the uterus or womb. The smooth muscle cell start proliferating, it start dividing and making more and more and more than usual. And this is happening usually in the beginning when the it is development of the embryo, the uterus is formed, and tubes and ovaries and neck of the womb. Slowly is growing because everything is dividing, but it come to the certain stage which is called fully mature organ in pelvic organ in the body. But in a fibroid size or any other things which is happening is unusual proliferation or unusual dividing of the cell of the smooth muscle started and make the fibroid. And that is what is the fibroid by itself is forming. Why it is forming, why it is happening.
And why are they so common?
Why it is so common? Because it is a hormone dependent. Because affecting is mainly increase in numbers, increase in size, because of the hormone, which is estrogen and progesterone, which is produced by the ovary. As you see, if how the womb is enlarged during pregnancy, because there is a lot of hormones around. But it's not only the hormone is affecting the smooth muscle or the cells, there is also a gene inside those cells which stimulate these cells to divide. So if there is a genetic predisposition, so those families or those cultures and those races which they have these gene, they have more dividing of these cells. And then the fibroid, and that is why it is common more in a black people than the white people. In certain cultures, in certain races, I have seen more in Filipinos, I have seen more in Chinese, because there is certain gene which is inside this smooth cell, and it induces the proliferation. And anyone in the family have a fibroid, especially the first generation. For example, if mother and sister having a fibroid, you have to think about it and you have to be investigated if you have also a fibroid or you don't have a fibroid. It can skip, but not always. It's most common in a family they have it, but that is a genetic predisposition and also hormone stimulation. So these are the two things which make the fibroid is growing.
Wow, thank you. Thank you so much for that. So I hear hormones and genetics, and also I hear Black and Asian women are the ones who are affected with this. And to be honest, when this started, when I started advocating for fibroids almost 6 years ago now, and I know that we were heavy on saying Black and Asian women, but recently, Dr. Umar, we started finding out that even the Caucasian counterparts, they have it. What I found out is that Black, more than Asian, I'm not sure how many Asians that I actually do know who've got it, but I know a lot of Black women. We have multiple. But you see, the Caucasian woman might just have the one, and it will be
one and big. Yes.
Yeah, so absolutely, but the stat is staggering, up to 80% of women will have fibroids by the time they are 55. That's a serious thing. That's and we ought to be talking about it. We need to be creating more awareness, more than just awareness, having action plan, to create the impact and all the researches that needs to be done. So thank you for that, highlighting the role that hormones play, and also the genetics. So I'm going to go to one of my guests. If you're fine to start, Kosha, I wanted to find out, to share a bit of your story. Tell us, when did you first realize that something wasn't right?
To be honest, I found out about my fibroids after having a miscarriage. When they found the first set of fibroids, was really tiny, and it was the case of, it's fine, we don't need to do anything about it. And this was probably about 10 years ago, and move on about 5 years, because they said to me it was fine, nothing to worry about. I just didn't think about it. I just left it as is. I've always had really heavy periods ever since I was a child, but then the heavy periods became not just heavy, but became extremely long. I could have my periods for up to 10 days. There was once I had my period for over a month. So I went back to the GP. They sent me for an ultrasound. And at that ultrasound, I remember asking for the report because my sister is a sonographer, and sending it to her, and she said to me, your womb is literally covered in fibroids. So I went back to my GP and I said, what are we going to do about it? And so that's when they referred me to the consultants, and it took 5 years for me to actually have something done about the fibroids and living with it since being told that my womb is completely full of fibroids.
Sorry to hear that. And honestly, what you've just said is something also I was addressing yesterday, and
Yeah.
I'm advocating seriously for is you don't tell a woman who you just diagnosed with fibroids to say not to do anything about it because they're small. That's just something to tell someone because that's the time to start to look into it, to start to do some fact finding,
Yeah.
your own due diligence to find out, okay, what's going to be different from now? How does this impact me? What does this mean for me? And all of that. But you can't just tell someone not to do anything about it.
And this is the importance for this platform, because I was one of those silent sufferers. I was one of those women who had no idea what this meant, because you grow up and you hear about fibroids, but it's, yeah, auntie has it, cousin has it, everybody has it, everybody carries on with their life. So you hear that you've got fibroids, you go, oh man, I got it too. And that was it. It's you don't think to ask the questions. You don't think. And one of the things that I found talking to aunties and my mum and etc., it's like, what was the impact to your life? It was like nothing, nothing. And I'm like, it wasn't anything. There was things that you were going through, but coming from a generation that just suffered through everything and it just was the way it was. That's what the experience was for me until I started educating myself. It wasn't until I was told that my womb was full of fibroids that I went, hold on, hang on a minute now. This is not normal, But it also upset me massively because this could have been prevented.
Exactly. So what I'm saying is I got really upset as well. Is one of the reasons why I started these conversations and charitable organizations, because I was told not to worry about it. So I went about my life doing nothing. I'm just eating all the wrong foods because that's the me gathering information. What's good for me to eat? What's good for me to stay away from? What kind of lifestyle? So I ended up going to eat something that was absolutely
captivating. Yeah.
up. I was taking coffee, all of these things bad for you, with soya milk every day, like 4 times a day. And I said, I'm bleeding 2 years nonstop. So these are the things that we're trying to, address, and making sure that women have education and information at their fingertips, and good information and education as well, because in this era of AI, people can just
any information,
to Google, which is not good for you.
And I think that's the important thing that you just said. Even though they had diagnosed me with having fibroids, I was given no information. It was simply just, don't worry about it. It's really tiny. It might shrink. That was it. There was no precaution. There was no warning. There was no come back and see us if so and so happened, whatever. It was just, you'll be fine. It's only tiny.
And that's not right. That's not why so many women have found themselves in the position where they are today, and they get to a critical position or point before they are getting the help. So I'm going to come back to you, Dr. Omar, before I come to you, Marvi, to tell us how this has affected you. But Dr. Omar, really, what was the role of lifestyle in because Coach has mentioned it a bit. I've mentioned that was a big major part of it for me. I mean, before I met you, Dr. Omar. So what's the role of lifestyle, in fibroids?
The lifestyle is basically what we eat is very, very important, because it stimulates and it has effect on the growth of the fibroid, especially, as I said, the hormones, which affect. You said that you had coffee with soya milk, and soya milk is full of estrogen, and estrogen is like a feeder for the hormone, as well as the weight. Weight is very, very important, because the fat tissue in the body, it produces estrogen, and is stimulate also. So the diet is very important, what we eat, and exercise, And a good, a special diet is not only, especially with the red meat and growth things and full fat milk, cow milk. These all have growth hormone in, which increase the size, increase the proliferation, and stimulate what is happening and make it bigger and bigger. Even if they are small in the beginning, you have to be careful, because that is what is important. So the exercise is very important. How we looking after our weight, as well as the diet, is very important to know. And in the Black culture, I understand that yam is a very special food, and it's quite eaten and quite consumed by the. So that's also contain hormone. Any women I tell say, "Oh my God, how I can't give up from yam?" I say, "No, you have to give up from yam." So that is another thing.
I had to mention this
Yeah.
yesterday. I mentioned that I was speaking about, I had to talk about this yam thing, and this, there's another African Nigerian food that we eat called amala. It's, you know, but thank you, thank you. I mean, I'm sure some women are hearing this for the first time, and thank you for that. Thank you for mentioning those.
Mhm.
Mavi, I'm going to come to you quickly. So tell us, how did fibroids affect you? How did it affect your everyday life?
Oh, well, I discovered fibroid way before, a little bit, way before I got married, about 5 or 6 years before I got married. At that time, I was just told, ensure you get married early because you have fibroid and it may affect your ability to have children. And it was not delivered gracefully. So, at first, my first reaction was fear, because I have been told I may not be able to have children due to the position of the fibroid. And well, thankfully, after a while, I strengthened my heart with prayers and the word of God. And then the real negative effect reared its head when I was pregnant for my first child. I had a very excruciatingly painful pregnancy from day 0 to the last. Very excruciatingly painful, because I was told that it's either I endured the pain alongside the baby, or I took it out and, maybe lose my baby and not have an opportunity to have another child. And I chose to keep the baby because I really wanted the baby, right? And I was looking forward to meeting my baby, but I had to deal with everyday, daily excruciating pain that came with bleeding while pregnant. I bled over 12 times in the pregnancy. That came with just when you look at other women who are pregnant, who are going about their normal lives, living their lives, doing everything, and there you are. What's different, how, just like Kosha, right? Just like she was saying, how, you tell your mom will be like, suck it up. I also have fibroid, I've been pregnant, I've had 8 children. What are you going on and on about? So there is that esteem issue that, okay, you look forward to having a baby, being a mom, how you see other women flaunt. It wasn't so for me. And the only thing I hung on to was God's word and encouragement from my spouse, encouragement from the people around me. But in terms of affecting me, I really, really experienced pain.
I
Yeah.
can imagine. Sorry to hear that. Thank you for sharing that. Dr. Omar, I wanted to speak into that a bit more, and from what Mavi has said, and also earlier on you had said about weight is also a factor that affects. To be honest, I do know I have a friend. She is very skinny, Dr. Omar, like
Yeah.
very skinny.
Yeah.
I don't know what size that is. I don't know if she's 6 or something, and she's got fibroids. All you see are protruding stomach, but she's a skinny woman.
True.
Over
True. It is very true. It's not only, that's what I'm saying, is is different from one person to another. And I have done unfortunately, for a very young girl, I mean, in her 30s, but she decided she can't have anything apart from taking the fibroid with the womb, because the womb was so enlarged with the fibroid, is 3.6 kilogram, and she is so slim, like a model. It just when I seen her for second time after 3 months of her operation, it's just like a model. She has no any. It's her body is a perfect body. Apart, even with that one, when she came and told me this is her scan and she have a big fibroid, I couldn't see it when she was standing, because it doesn't look like. It's the it basically how these fibroid can stimulate, can be affected by what. Some of them just genetically is horrendous, is very aggressive, and some of them just can be dealt with the diet, with the exercise, with the weight, with all these things. But some of them, they really aggressive, and they just increase in size, whatever you. And to be honest, I can see the people which they have a fibroid, and I see them, it's 50-50. 50% of them, they are slim, they are very, not only about slim, they are fit, and they don't eat this, don't eat that. They are very aware of everything. And the other 50 can be slightly overweight, can be eating the wrong thing, but it is the aggressiveness of the proliferation and dividing of these cells, how the genetic is more aggressive than somebody from the other.
And that's interesting that you will say that honestly. So I mean, basically, so genetics may increase the
Yeah.
feeling, but doesn't determine, the young woman, because there's a lot of cultural biases, especially also because I've had a young person tell me the reason they didn't want to talk about the fibroids or have conversation around it is because their parents' mom had discouraged him from getting married to her because she can't have children for him. And I had to say, look, that's true.
Wow.
I'm grateful to God, I've had 2 children. And so what's important with fibroids is, as long as you know, you have your education and you're informed, and what's critical is knowing the sizes, knowing where they are, so you know what type of fibroids, and so you can know what to work towards and what kind of plan you want to put in place, regarding treatment. So that's really important. I'm gonna come to you, Kosha. So, were you aware of family history when you started, when you found out about your fibroids, looking back? And were there any warning signs for you before the miscarriage?
I think my instinct is to say no, because there was no conversation about it. It was afterwards, while talking about that this was said, etc., that we're like, oh, this auntie had that, this one had that one. So there was no awareness of it. I mean, we talk about the high blood pressure, we talk about the cholesterol, we talk about all of these things. If you'd asked me about my family history regarding those things, heart disease, etc., I could say, okay, yes, this uncle, this auntie, this grandparent had it. But it wasn't until I had my own diagnosis and talking about it, that's when it started coming out that actually this part of the family had it, this person had it. But prior to that, it was just not a conversation.
Thank you for sharing that. That's another thing that I wanted to ask you, Dr. Omar. So some have no. How do you deal with that? How do you you have no symptoms, so you haven't even got a starting point to say, oh, let me check something. You don't know what to do. You don't check anything.
I think the most important thing is educating parents. Educating parents is very important, and I can see now they come with their young daughters, which they are in their 13 and 14, and they asking for this question. when they see that certain gynecological disease, I am talking about gynecology more than any other illness, when they have their parent or their auntie or their sister have some gynecological problem, they bring their teenage children and they say, can we investigate if my daughter or my sister have the same thing as I have, or as the same thing as a mom has? It is educating parent is very important, because it's not only the young girl saying I have pain, and if the mother doesn't know, if the mother thinks that this is normal for her and or can be dealt with earlier than she had, is much better. So now, for example, I had a patient which is asking, she's have severe endometriosis. She brought her daughter to see if she got, and how we can approach and how we can diagnose this. This is a real education. This is a very good thing. I'm not going, in the past, maybe doctor said, what? Why are you bringing such a young person to me and to talking about it? No, it is the approaching that girl, knowing what is that disease, knowing how to know the sign and symptom of that disease, and to diagnose it as early as possible. So not only educating a young people, because the parent may not listen to them. Educating the parent is also important, to listen to their children when they have a period, how the period can be. Yes, can be heavy, can be a bit painful. Slowly should be better, not to be worse. If it is worse, has to be investigated. Even if investigate this year and everything is all right, in a 2 years time, things is changed. So regular checkup is very important, and education is very important to diagnose it.
Very important point that you have highlighted there. I'm going to come back to you both, to ask you if you were believed, or did you, I want to talk about gaslighting a bit, but were you believed when you talked about your pain and the things that you were going through whilst you were living with, or when you were going through your journey of fibroids? But just before this conversation, a friend of mine messaged me and said, oh, because she has young girls, and she said, can we start a conversation, to start to educate early parents and their daughters, like mothers and their daughters. She said, look, because I'm worried, some of the things I've learned on this platform, but I'm worried that some other women haven't started to do that, because she's got a 6 and an 8-year-old girls. And I'm like, okay, actually, that's a good idea. Let the mothers know, and then we start. So because anyway, so it's really important thing that you've highlighted there. And so we're going to extend FHF educating the next generation to much
previous generation to affect the next generation.
Yeah, so it's
Yeah,
going to
absolutely.
mother and daughter kind of sessions that we will have, because it's not just the person living with fibroids, the whole family is affected when someone's living with fibroids. But thank you, Dr. Omar, for raising that. But I wanted to ask you, Mavi, and also Kosha, after Mavi's gone, when you had your symptoms and your pain and all of that, parents, people who were supposed to be looking after you, doctors, did anyone believe you? Did you ever get gaslighted? Tell us a bit about that experience if you've had it.
No, well, the first time I started having the pain, I thought it was period pain, because I used to have very painful periods. And who knows, it might have been because of the fibroid, but it was never checked, because it was expected, from where I come from, young girls have period pain. So it was like normal. I'm not saying period pain is normal. I'm just saying that it could be put under the category and labeled normal, right? So I thought it was period pain, but when that particular day, when the pain became excruciating, it was my father that took me to the hospital. And no, I think I was supported. I think that I felt the love of my family. And I don't think that my pain was was reduced or tried to make light of. And honestly, in retrospect, I think that was the strength that took me through when I would have a child and had to bear the pain, So I didn't really have I didn't feel like I was abnormal. It was just painful. And at some point, I became a prayer point, but I didn't feel ostracized. I didn't feel like that at all.
Sharing that. What about you, Coach? What was your experience?
Very similar, where ever since I started my period, I had really painful periods. So I became the child with the painful period. So whenever I started complaining about any kind of pain, for me, though, it was just kind of brushed aside. Here we go again, because it was so normal for me to be in pain. So it was just like, okay, it will pass, like it always passes. That for the doctors, it was very much similar. It was just kind of like, it's just the way it is. You've got dysmenorrhea, just use ibuprofen, just use paracetamol, just use naproxen. I didn't get that support that Marvi did. But I also don't say that in a judgmental kind of way, because as I've already established, there was no awareness in my family community. So they had no foundation to kind of support me from. So now I'm trying to build that foundation to say to others that, come on, this is not normal. And I think working with the younger generation, as you said, is very important, because I don't know if Dr. Omar could verify whether it's endemic in our culture that girls have extremely painful periods, because my daughter now has extremely painful periods, and quite a lot of people that I know around me have really painful periods, and this is pre fibroids. So when we normalize it from that early, when it then advances to something else, we've already been cultured into normalizing. So we normalize the next experience, and then it just becomes what it is, and we just live with it rather than doing anything about it.
And it's difficult to catch, early.
Yeah.
Dr. Omar speaking to that. But whilst after you've done that, Dr. Omar, I also want to be able to explore and tell us what treatment options there are, especially now, because I want to just remove the myth that it's only surgeries that women can have, or it has to end up in hysterectomy. So, but please, speaking to what Kosha just said, because I did get my husband's support, to be honest, because I'm the one who wouldn't say anything, who wouldn't tell anyone anything. And like Kosha said, I thought heavy period was normal. So I just used to go about my business and doing my own thing. Even when I was struggling, I was working in the city, and I was struggling, but not one member of my team I was working with knew what was wrong with me. I had stash of sanitary pads in different angles of the bathroom in the bank, and I will warn the cleaners, please do not touch this bag, because I want to be able to dash out of a meeting to just jump into the bathroom quickly and go. I have change of clothes at work. I have sanitary pads, different types, sizes, just so that, and it was. So we'll talk about how that affects us mentally. I mean, whilst you were going through, please share how that affected you as well, your mentally, how it affected your confidence. But quickly, Dr. Omar, tell us what options are there.
The most important thing is period can be painful, but cannot affect all the quality of life, should not be affecting the school, should not be affecting the child not to go to school, or at school to have to come back and running and rushing. I have this young girls. Stress of social media, stress of life is affecting them, yes. But period pain and heaviness of the period should not be taken normal. And if, for example, diagnosed as nothing, and they have scan, they have everything, and they've been told it is okay, don't worry, is nothing, does not mean that end of the world. It has to be checked at least every year to see if there's anything else is coming, why this girl have such a big pain during the period and a heavy period, and her friend has nothing. There must be something is brewing, something is growing up, but not visible yet, and slowly can be visible. I have girls, they miss 2 days of school because of the pain, not because they don't want to go to school. They're not because of that, because they want to go to school, but they can't be it. And also school teachers, carers has to be educated also. It's not mean. Look at the grade of that girl. Is it bad enough to say, oh, they want to miss the school? Is being bullied, that's why she want to miss the school? Or just those 2 days or 3 days a month she can't come to school? So this education of the surrounding as well as the young girl is very important, to speak loud and to say, I am in pain. It's not a normal. It's not normal if the grandma has a pain or a mother has a pain. Yes, but because they are not diagnosed early. And the other is not only a fibroid. Fibroid at least is visible. Fibroid can be investigated. Fibroid can be shown by ultrasound. Endometriosis cannot be. Cannot be unless if it is a higher stage. You don't want a child go to the 25, 30 and be diagnosed with a higher stage. So you want to be investigated earlier to plan for what you're going to do next. Even if she has a fibroid, to check it regularly to see if there is more coming, if it is interfering soon with her fertility, is it interfering with her life, with her education, with her progress in career. These are the things which has to be told and to be educated. I believe some of these subjects should be educated in the school, to be honest. Why they have some lessons which is basically not, yeah, maybe useful, but the other lessons is not useful, and then these things to educate the children, especially the girls, what is wrong. Yeah, they educate them about the contraceptive pill, but they don't educate them about the pelvic pain and the period and heavy period and what to do and what not to do. So these are the things has to be highlighted, has to be told to the girls, not think that everything is normal. It's not normal.
Yeah, thank you so much. That's such a great point you mentioned there, and is the reason also we're trying to do more school workshops on the CBRNS. So we
Mm,
continue
mm,
it and let's the young
May I speak?
young girls be more aware and be knowledgeable about these things
mm.
and know what to look for, understand their own body, and then so that when something's wrong, they call it out quickly. That's
Yeah,
that's
yeah. And the effect is not just telling you, oh, you have a fibroid, go home. Where is the fibroid? How many fibroid? What is the effect in the future, in the fertility, in the pregnancy effect in fibroid? These are should be discussed. Should be discussed with a woman who is suffering from this. If they just told, oh, you have a fibroid, it's the size of the fibroid. Is not the size is important, is the location is important, is the impact. I have seen 75-year-old with a big fibroid, but never affected her life, never knew she has it. But you have to tell that when you diagnose it in the age of 17 or 18 or 15, then you have to tell them, this is the impact, this is the thing which can happen. You have to be monitored, you have to do that, not just go and marry, have children because you have a fibroid. You may be infertile. You may not find a man which fit you to have a children with. You have to know what is going on.
right. That's right. And that's really important. Teaching women how to advocate for themselves, and be able to
Mm.
pick up, when things don't seem normal, because everyone's normal different, isn't it? So being
Yeah.
able to be a notice
Mm.
and call it out, what
Mm.
okay, this is abnormal for me,
Mm.
and get it
Yeah.
investigated. Amazing.
And don't accept the doctor. Don't accept from a doctor say, oh, you are anemic because you are heavy bleeding. Have iron taken. Do take iron. Is why I am bleeding so much. Why I'm anemic so much. What is the anemia is impacting in my life? Anemia can stop your heart.
It can.
Severe anemia can stop your heart. can be making you so tired, can be making you away from school, from education, from your career. You sleep all night and day, and you can't work, you can't clean, you can't do your job. So why I am in this position? There should be more help for this than giving me a tablet and take it home.
Yes.
Yeah.
Definitely. Thank you for that, Dr. Omar. I want you to touch on treatment options, but before we go to treatment options, I wanted to ask you a few questions that came in around, if fibroids can turn cancer, and also if fibroids can all go away, because I guess you will touch it when you talk about the different treatment options. Can come back after surgery? We know that they can, and then menopause cure fibroids. So tell us a few of the treatment options that are available now, and then you can.
There is basically either medical or minimal we call it minimal invasive, and there is invasive surgery. The medical one, there is a tablet which suppress whole the hormone from the brain to the ovary, and it is effect on a fibroid, because as I said, there is a hormone feeder. So what will happen, this tablet, which has to be taken every day, can stop the bleeding, can make the fibroid smaller, but it take a year to make a half size. And very much like too many fibroid, it is very difficult to deal with a tablet. But the tablet also have it is a disadvantage, can make like a menopausal symptom, hot flush, sweating, headache, tiredness, but maybe tiredness also be replaced by a bit of energy from not losing blood. And also you have to be careful at the end of the year, you have to have a bone DEXA scan, because can cause brittle bone, can cause osteoporosis. So yeah, and also when you're starting from the beginning, you have to have a good liver function test, because if the liver function is not well, it may damage the liver. So these are the tablets. Well, another one which also is not approved by the GP surgery, they have one type they can prescribe it. If we prescribe first month, then they prescribe the other one is say within 6 months have the same effect as the first one within a year. But it is useful for smaller fibroid, I believe, and it is useful for the not multiple fibroids. If there is a 2 or 3, may be very useful. Or if the woman just want a year to have this, make it smaller and try for pregnancy, or see how it go. This is a tablet. Injection, people hear about injection. Injection is only allowed to 3 to 6 months, but it is more or less for preparation for the surgery. Because as soon as you stop injection, a similar thing is happen, it's come back again. And also it has a major side effect of hot flush, depression, headache, all symptoms when the menopause women have. And you have what we call add-back therapy. We have to give estrogen to support the bone after 3 months of injection. Then you have another way, which is called uterine artery embolization. This is minimal invasive. It goes through the groin under sedation and local anesthesia, which block the blood supply to the fibroid. If it is reasonably 4 or 5, it is more or less is possible. But there are also, if it is too many, may block also the blood supply to the uterus itself and cause emergency hysterectomy. And there is a 5% chance it affect the blood supply of the ovary, and a woman can end up with menopause. If the woman have no intention to have more children, or doesn't want children, is a very good idea. And I have sent patient quite a lot to the radiologist, and they benefit from. The fibroid becomes smaller, doesn't go, and doesn't activate again. Within 50, 70 women, which I have my experience with them, is one of them is come back again, and it's just active, just growing. So you have to do either taking the fibroid away. If it is 1 fibroid or 2, can be do through the minimal access surgery, through the laparoscopy, or robotic surgery can be taken out. But if it is too many of them, you have to do taking the fibroid, knowing this is basically for fertility and if they are young. And also because there is always a risk of coming back. If they are 35, they have 15 or 20 or 100 fibroid taken away. By age of 45, they will have some fibroid coming back again. The other option, if they finish their family, they are over 45, you can take the uterus out with the fibroid. And if they are, that's basically if they are menopause. In menopause, basically the symptom of menopause is not a very good thing to say, oh, I wait for menopause, because I have patients, they say, I wait for menopause and the menopause will make it smaller. Yes, it makes it smaller if you are not taking any hormone replacement therapy, because the hormone is a feeder for the fibroid. And how long it takes to become smaller, we don't know. Some people, they become smaller very quickly, some people not. So the menopause by itself, symptom of menopause is headache, hot flush, sweating, lack of concentration, depression, and low energy, less activity, angry, and anxiety, palpitation. Is that a nice symptom to any woman have? No. Brittle bone, osteoporosis. So do you prefer to have your fibroid be taken away or something to be done to and then go to the HRT, or you wait in 5 years to become menopause and become smaller? So every woman, you have to weigh. There are point, number of fibroid, location of fibroid, fertility of the woman, age of the woman, what they hoping to achieve. Menopause is the difficult thing to happen to them or not, or they just want to finish. And also don't give them a 2 minute to decide. This is not a 2 minute decide. They have to go away. You have to write it down to say, these are the options and these are what I'm giving it to you. And these are the possibility. You make a decision, but come back, we discuss it, because they make a decision which is not fit for them also. Then you explain again that decision has disadvantage and advantage. Then when they make a proper decision and they are really want to do that, then you can decide which one they can. And you can start from first till the end. Don't go to the end straight away, because going to the end is no way back.
Please don't jump to hysterectomy straight away. There are other options that women can explore before we get to
Don't jump. Try everything. Try everything.
Thank you. Thank you for highlighting that and talking through that. And our time is fast spent. I could talk forever fibroids, and I always love when women share their stories, because we have different journeys, different stories, and that way we're empowering that someone else is learning, some young woman is listening, and then she can go away and have a better outcome and a different outcome than we've had, which is one of the aim, my goal when we have this conversation, so that someone else is leveraging and being able to find benefits and things to do differently to have better outcome. Thank you. So our time is so fast spent. Thank you so much for joining me, ladies, tonight. But quickly before we go, what's the one final message that we will like to share with women tonight? What one woman who's listening to you tonight, Mavi, what would you like to say as a final note?
The main thing: be loud, say what you're suffering from. Don't be affected by surrounding, not family or friend or education side or anyone at work, because at work you may have a even as a mentor or as a head of the department, as a woman, they don't know, if they're not going through the same thing as you, they may not know anything. Not only a man, maybe man more sympathetic if their wife is suffering from the same thing, but the woman, if not suffering, they don't know what you're suffering. So be loud, and also go to your doctors and explore everything you know, read about it. When you go there, tell them why not, why this not, why that. And also, not every heavy bleeding and every painful bleed period is normal. It is not normal. And if 1 year you are being investigated, and you don't just carry on whole your life, say, I have ultrasound 5 years ago. have another one in a year, see what is going on. Any change can happen. So be advocate for yourself, present yourself as much as you can, and listen, and then have choices. There are many choices, and you have to choose the choice and then discuss it again and again. That is the most important thing.
Absolutely. Thank you so much for that. Yes, explore your options. There are many options, so please explore all options. Coach, I'll let you leave one final note for women before we round up tonight.
I echo that. Be loud. Educate yourself and ask questions and demand answers. Don't just take being brushed off. Demand answers. And if the answer you get doesn't feel as if it's answering a question you don't even know you have, keep asking until you get the answer that feels satisfactory and as if it's going to help you.
Amazing. Thank you so much. And Marvin?
Basically, same thing as other women have said. Be aware of what's going on in your body. Do not minimize any sign, any symptom. Don't write it off as something that is normal, like she has said, like Kosha has said. And finally, find a community. Be a part of a community. Talk. Listen to other people talk. Share their experiences, because you can't go through this journey on your own. So that would be my word, my own word.
Ladies, this has been an amazing conversation. I could talk about fibroids on and on and on, but I hope this has helped one woman or two or 10, and I do hope that women can leverage on this and start to do things, to help their wellness, advocate for yourself, speak up. And we know now that genetics, may increase your risk, but they don't define your futures. It's all about finding what's going to work for you, finding your own pathway, but with other women, educating yourself, being informed and making sure that you are calling it out and you are shouting out, these things. Yes. Whether you're living with fibroid or supporting someone who's living with fibroid, simply wanting to learn to know more, because it's not just the woman, it's going to be the brother who's affected, the husband who's also affected, the children, and the whole community if one woman is suffering or the women are suffering. So thank you, everyone, ladies who's joined me tonight, and for everyone who's listening.
Thank you
So much. I hope this has been helpful, and I hope that we're learning and we're engaging and helping ourselves get better. Fibroids is a real thing, and don't let anyone minimize your pain. Let's help one another and let's be well. Thank you, everyone, for joining.
Thank you so much. Thank you. Very kind of you, and have a nice evening.
Have a lovely evening. Thank you, everyone. And everyone who's live, thank you so much for joining us tonight.
Thank you. Thank you so much.
Thank you. Thank you. Bye, everyone.
Bye, everyone.
Bye. 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 Bye.
I don't leave this.